Well, welcome. We're joined today by Holly May and Josie McDaniel Burkett. We thank you for being here. Ladies and gentlemen, today I've declared a state of emergency for the state of South Carolina to address the rising threat from the coronavirus. Effective immediately, I've ordered the following. Schools in Kershaw and Lancaster counties to be closed Monday, March 16th and remain closed for a minimum of 14 days. The South Carolina Department of Health and Environmental Control to consult with the Superintendent of Education, Molly Spearman, and local school district leadership to provide guidance on if and when remaining school districts should decide to close schools and for how long. Superintendent Spearman has been in hourly contact with the school district superintendents and administrators, and I would like to thank her and the local school district officials for their patience and professionalism and attention to this crisis. I know that they, like everyone, are under a tremendous amount of pressure in making their decisions. All state government offices are to remain open for operation during the enormous business hours. State employees shall report to work as usual. Visitation at state, county, and local correctional facilities in all 46 counties are suspended immediately. DHEC is to immediately restrict visitation to nursing homes and assisted living facilities, with the exception of end-of-life situations. State price gouging laws are to go into effect immediately. And the state emergency management plan is to be activated immediately. In addition, I've requested access to federal assistance provided by the Federal Small Business Administration for direct SBA loans for our state's small businesses that have been adversely affected. Also, I've asked the General Assembly to pass a bill appropriating $45 million for DHEC as DHEC coordinates the state public health response to the coronavirus. This is in addition to the $8 million that Congress has appropriated for South Carolina. Ladies and gentlemen, the past 48 hours have seen remarkable activity across our nation. Professional and college sporting events have been canceled. March Madness, the Masters, the Carolina Cup, the Volvo Car Open, and we don't know what's next. Disney World is closed. Meetings and conferences have been canceled. Even church services have been canceled as we approach Easter. Many South Carolinians are anxious and worried. They're worried about their families, their parents, their grandparents, their children, their jobs, friends, and co-workers, and they're worried about their own health. That is entirely understandable under these circumstances. I want to assure every resident of this great state that your team, Team South Carolina, in all of its capacities, is engaged in working to get us through this crisis. And we will get through this. And we will get through it by using our heads, by being smart, by being deliberate, by staying calm, and by using common sense, and always by working together and demonstrating courtesy and compassion towards each other. Today, we have taken the best course of action for our state, for our people, and for our future. Let us remember that we as South Carolinians are resilient. I have faith in every South Carolinian. We are known around the world as friendly, hardworking, and honest people, a reputation well-deserved. As our daily lives are impacted and disrupted by this coronavirus, let us all remember that and be proud of South Carolina. Dr. Bell, Linda Bell.
Thank you, Governor. Good afternoon. South Carolina, along with more than 36 states, is now reporting positive cases of a novel coronavirus named COVID-19. This is part of an expanding outbreak worldwide of a respiratory illness that began in December 2019 in Wuhan City, Hubei Province, China. As an update, DHEC is investigating one new possible case of COVID-19 novel coronavirus from Camden in Kershaw County. The one new case is a female in Camden who had contact with a known case. She was evaluated at a healthcare facility and is currently isolated at home. DHEC received her positive result from a private lab late yesterday, March 12th. To date, DHEC's public health laboratory has conducted 123 tests, 13 are positive, and 110 are negative. We have learned that the latest cases in Kershaw and Lancaster counties do also have links. We are continuing to investigate and will update the public as other new information is known. Our top priorities remain preventing the spread of the disease and protecting the public health. This includes working to control spread and measures that best protect all individuals. We know that many residents are concerned about what impact this virus may have on future operations of many of our institutions, including our schools. The CDC has provided guidance to help determine a course of action based on specific circumstances of disease activity for each community. We are monitoring the status of the virus in South Carolina to make informed decisions about large gatherings. We have no evidence that the cancellation of schools and events outside of Lancaster and Kershaw counties is needed at this time. We are constantly monitoring our epidemiologic data and following CDC recommendations for strategies to slow the spread of disease in our communities. We've been receiving a lot of questions concerning schools and other larger gatherings. I want to emphasize school closures and the cancellation of larger gatherings and events, from church services to festivals, should not be taken lightly. Waiting to make decisions until the correct time, combined with other social distancing interventions, including staying home when you are sick, is an effective approach to limiting spread despite potential disruption. Other states are also beginning to practice social distancing. What we're doing in South Carolina is based on what's happening in our communities now. We do not have widespread transmission in the state at this time. In Kershaw and Lancaster counties, where we've seen person-to-person transmission, those cases had close contact that occurred through either household or other close contacts, and we continue to monitor the ongoing situation. This includes making precautions for our nursing homes and assisted living facilities, as well as other vulnerable populations with unique circumstances. While the CDC has stated that we will see widespread transmission in the United States, the majority of cases will have mild illness. Although we are not currently seeing widespread transmission in South Carolina, we expect to see more cases, and we will continue to monitor CDC guidance and recommendations. As part of this effort, we are preparing for transition from containment to mitigation. The goal of containment is to identify individual cases of illness and stop the chain of transmission from individuals when possible. As cases increase, the goal of mitigation is to increase the practices of social distancing, to help slow the spread but not stop it, and to assist healthcare systems in continuing to provide care and to more slowly absorb the cases that are being reported, particularly to provide care for those who need it most. At this time, it is recommended for the majority of South Carolinians to continue their daily routines with a focus on protecting against illness by practicing good hygiene, including routinely washing your hands and covering your mouth when you cough. Again, each of us can do our part to protect those who are at risk of more severe disease, and it's all of our responsibilities to help prevent the spread of illness. Individuals with signs of illness are asked to take seriously the recommendation to stay home from school and work and not attend public gatherings. Reach out to your healthcare provider if you are showing signs or symptoms of illness such as fever, cough, and shortness of breath. If in the future Our medical experts and epidemiologists feel a change to this recommendation is needed based on our surveillance data and disease investigation activities. We will immediately notify the public. We are still learning about this virus, and we are committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. For the latest information, I encourage you to visit our website at scdhec.gov/COVID-19. Thank you, and I'm happy to take any questions.
Dr. Bell, you can get tested right now. Is there a certain criteria of even if people test kits if they believe that symptoms of COVID-19?
Yes, there are specific criteria for the symptoms of fever, cough, shortness of breath. Also taken into consideration is a possible history of any contact where disease transmission is known, and if there's no other explanation for the illness.
Doctor, with that said, we've had a number of viewers call our TV station saying, hey, I believe I have some of these symptoms. I actually went to my doctor. I could not be tested for the coronavirus. They're frustrated by saying they are having to jump through hoops to get tested to see if they have this.
And we're glad to report that testing is now more widely available through reference labs. And previously, DHEC was required to have all individuals meet the CDC criteria and approve testing through our DHEC lab. But at this time, DHEC will no longer have to approve testing. We'll leave it up to the discretion of individual healthcare providers to make a recommendation for who should be tested.
Follow up on something you said a moment ago. You said other than Kershaw and Lancaster counties, there's basically no need to cancel events or public schools to shut down. We've already had cancellations in Columbia, Lexington, and other areas of the Midlands. What's changed in the past 24 hours?
Well, DHEC is providing information about disease transmission, disease activity in those counties, and other than what we have previously reported with the positive cases, nothing has changed. So we are providing the information for individual entities, organizations, event planners to make their decision about social distancing and about large public gatherings.
President Trump mentioned not long ago about the national emergency that there would be some drive-up options for testing around the country. Could we be seeing any of that here in South Carolina?
There are arrangements being made in South Carolina for drive-up testing through some health systems. But the drive-up testing is a support function to telemedicine. So individuals must first be evaluated by a healthcare provider through telemedicine, and if they meet the criteria for testing, then they can be tested through one of these drive-through opportunities. If they have not been previously evaluated by telemedicine, then they will be turned away.
As these tests
ma'am.
become more widely available, can you post online where they can get tests? Because people are saying they've been told even by their doctors you can only go to emergency rooms, but they don't want to infect people in emergency rooms.
DHEC has provided a health alert to provide information about where testing is available, the recommendations for testing, and because testing is now more widely available and because the demand for testing has increased, just in the last 24 hours, we will actually be issuing another health alert that will provide updated information about testing guidance where testing is available.
Can you
Let's continue
A
with
senator
that.
said publicly yesterday from the podium that these test results take 48 hours to get back. Is that the case? And is perhaps something be done to speed up that result time?
It depends on the lab that the provider uses. The turnaround time varies from one lab to another. It varies anywhere from about 24 to 48 hours in our DHEC lab, and these private reference labs are reporting that they can turn around a test in 3 to 4 days, and that is from the time that they receive the specimen.
Yes, ma'am.
Thank you. Can you give some more specifics on how these standards will be lowered so that people can get tested? Less than 130 tests still seems like a very low number here in South Carolina. So what does that mean as far as specifics or standards of going in and getting tested?
Well, one thing is that we don't see evidence of widespread activity in South Carolina. So because the test is indicated for those who are ill with symptoms consistent with it, that means that that number of people are meeting the criteria. What I'm explaining, we're not lowering the standards, is that we are no longer requiring for a DHEC DHEC medical consultant to approve the testing. So a healthcare provider, if at their discretion, make the decision independently that the individual meets the criteria, the DHEC medical consultant does not have to approve the testing through the DHEC lab. Healthcare providers can also use these other reference labs that are now available.
After a person has been tested positive for the coronavirus and has been quarantined for about 2 weeks and a 14-day period, afterwards, what is the next step for that individual to take?
So individuals who have been diagnosed are asked to self-isolate until their symptoms have resolved. The monitoring period applies to the close contacts of individuals who are not ill, and they're asked to restrict their activities to make sure that they don't develop signs or symptoms of illness within 14 days after contact.
Officials in other states have estimated that there are actually a lot more people sick and actually given numbers of those estimates than the people that have tested so far. Do we have any sort of estimates like that in the state?
Repeat the question, please.
So officials in other states have said that, for example, while we only have X number of cases confirmed, we estimate thousands, perhaps 10,000 more actually have it in the state. Do we have any sort of estimate for how many might have it beyond those confirmed?
No, we don't have an estimate of how many more might have it, but as we're monitoring for signs and symptoms of illness and providers are aware of what to look for, and we're testing those individuals who meet those criteria, we don't expect to find every person who's diagnosed, particularly if cases begin to increase, but at this time, as we're evaluating those with symptoms of illness, and we're testing, the proportion of positives also tells us that if we have a fair number of negatives, that's an indication that the screening that we're doing is reasonable because we are detecting a fair number of negative individuals. And also, as we compare ourselves to other states, be reminded that our population is quite different from these other states.
Will individuals who have tested positive for the coronavirus and no longer have symptoms after that 14-day period, will they be retested?
No.
And I know with a lot
Yes,
of
sir.
hospitals in the state, like MUSC, Prisma Health, they're doing these tests, these virtual tests. Have those had any correlation at all to any positive results?
A virtual test?
Like the way that MUSC goes about the free virtual care screening. Has that led to anything, any positive case, any correlations at all?
The telemedicine involves the opportunity to visit with a healthcare provider remotely through a television screen, basically. And that assessment includes you taking a history, the healthcare provider taking a history, checking for signs and symptoms. If through that history they meet the criteria, then they have to be referred to a healthcare provider to actually collect a sample to be submitted for testing.
Are you considering that there could be more cases of community spread, especially in Kershaw County, where it's believed to be the case now?
We do expect to see additional cases. That's why we're screening, and that's what we're seeing in other communities in the United States. So we do expect to identify additional cases. The degree to that occurs depends on how successful we are with social distancing and other measures, asking people to practice good hygiene, to stay away from large gatherings if they're ill. If those social distancing measures are successful, then that will limit the spread of disease in our communities.
Speaking of social distancing, Governor, there's a report that you're going to a parade tomorrow in Greenville for St. Patrick's celebration. Are you still planning to go and attend that festival parade?
That parade in Greenville has been canceled.
Answers that question.
What's the status of MUSC's application to process the test? Do we know?
We can get that information for you.
A follow-up on the test question, if I can. There's certain criteria that people have to meet in order to get this coronavirus test. Do you foresee a time in the near future where those criteria will be dropped? In other words, if I want a test, I can get a test, as I'm being told by some national and state leaders?
The criteria are based on what we know about the signs and symptoms of the illness. And if non-healthcare professionals are making recommendations about the indications for testing, we ask people to pay attention to the criteria for testing that are based on the symptoms of illness. So the criteria for illness won't change because that's how the disease presents. It is not recommended to test individuals who are asymptomatic, and as the testing burden increases, we may have to focus testing on individuals who are more severely ill and on healthcare providers who are having direct contact with those individuals. So the appropriateness of testing is very important, and we don't want to test people who are asymptomatic or who otherwise believe they need a test. That has to go through a healthcare provider.
With the declaration of the state of emergency, could you walk us through how these additional resources could help healthcare workers, hospitals throughout the state?
Well, we have our declaration here, and also the president has made a declaration this afternoon as well, and through the Stafford Act and the National Emergency Act, there'll be funds available and assets available, and red tape will be eliminated, and their flexibility will be exercised in Medicare and Medicaid and those types of federal activities. At the state level, many of the things that have been done in other states through declarations of emergency have already been done by us. With our system, we have more authority to do things, but there are some things that are required where the state of emergency is required, such as what I referenced about prisons and nursing homes and those sorts of things, and that's why we have the state of emergency here. As I say, all hands are on deck. This is something that we are very concerned about, and we want to be sure that the people of South Carolina are as safe as possible in all capacities. Yes,
Down
ma'am.
in Charleston, they're concerned about the cruise ships. Are any plans to say cruise ships can't dock, or do you even have that authority?
That is the Centers for Disease Control and the Border Patrol, and there's another organization that is involved in those things in Charleston at all ports, and the rules and regulations of the Centers for Disease Control are being implemented there now.
Governor, when did you make the decision that an emergency would be necessary? Previously, we heard schools wouldn't need to close. You were planning to go to the St. Patrick's Day celebration. When did you decide more was needed than one?
We were, as more information came in and we learned more, and we were getting a better feel and understanding of the capacity of this illness, we started moving in that direction. We want to be precise. We want to act with precision and deliberate speed, and not make quick decisions that are unnecessary that lead to panic or a lack of understanding among the public. So this is something we have known all along may come, and in South Carolina, based on our facts and circumstances, and following the information and recommendations of the professionals. This is something that involves science, it involves medicine, and we are relying on our people in our state at the Department of Health and Environmental Control.
Was there one closing access to prisons? Why can't we?
Right here.
You have said consistently that schools should consult with DHEC before making any plans to close or anything.
That's right.
What does this declaration do differently in that regard?
It emphasizes that we're closing 2 districts. I've ordered that.
Right, but I mean,
based
in terms
on
of districts deciding what to do for themselves, like Richland 1 is called an emergency school board meeting for Sunday.
Well, what we are, in this order, we're making it official, that is what we want them to do, is to consult with the professionals at DHEC as they make those decisions. Yes, sir.
You were talking about limiting access to prisons. What about the courts? Is that still an access point possibly for these prisoners too? We look at maybe shutting down the courts like they've done in Georgia. What are the thoughts on that?
I don't, say it again, please.
System, we talk about limiting access to prisons. What about the courts? If that's still an access point for prisoners to be exposed to the public if they're in court, for example. Are we going to keep the courts open at this point?
Yes, the courts will remain open. Of course, that would be a subject for the Chief Justice. That is not addressed in this order, but the prisons are, and we want to restrict that access in those prisons. Yes, ma'am.
Quick question about the $45 million spending bill. Has that been approved at this point?
No, ma'am. But it is Senator Leatherman and others in the leadership, the Speaker and the Chairman of Ways and Means, Merle Smith, all are, as well as President Peeler, understand the need for this and are supporting it, so we expect it to be done very quickly.
Dr. Bell, to clarify, are all 9 cases in Camden all related to the original case that was discovered or reported on Friday?
No, they are cases that are related to each other, not all related to,
That woman.
in the entire group, they're not all related, but there is person-to-person transmission within those positive cases.
How did you come to that 45 million estimate of the amount needed?
The 45 million was decided upon in contemplation and conversation with Department of Health and Environmental Control as to what they would need to do the things that are necessary to take care and protect and support the people of South Carolina. As other things become necessary, we'll take other steps.
Now, will that go more towards testing or towards the vaccine?
That will depend again on the needs of Department of Health and Environmental Control. As Dr. Bell has said, things are changing. This is a very fluid situation, but we expect that it may be used to hire additional personnel, to keep offices open, to man phone lines, to provide supplies, those sorts of things. And we want to be able to use as much of that or all of that as necessary. But that is the number that was given us by DHEC.
Superintendent,
Yes, ma'am.
what is your advice to the two school districts that must close? I mean, how can they continue learning, or will they be able to?
I've been in contact with both superintendents. We sent out a memorandum yesterday afternoon to all districts in the state. We have 15 districts that already have a virtual learning plan. The others are submitting those plans to us now for instruction. We asked them to work on instruction that might cover 2 weeks, and that would be implemented as needed. We're also working with the 2 districts in Kershaw and Lancaster for using our summer feeding program, where we will continue to prepare meals and make them available. We've got some decisions to make on how those would be distributed, but we're trying to keep things as normal and make sure those children have access to food and to some type of academic work.
And the 2 districts that will have to close now, are they among the 15 that already have plans?
One of them, Kershaw is, Lancaster is not, but I've spoken with their superintendent, and they're, as we speak, working on instructional material for their children.
Superintendent, what about the kids in Lancaster and Kershaw County who don't have access to Wi-Fi?
Well, we're working within their plan. We've asked for those districts to address that, and in those cases, if Wi-Fi is not available, they'll be sending paper and pencil work on. So we'll need the parents to work very closely with their children and their school personnel.
Superintendent, I have another question for you too. What precautions are you urging right now for school districts that are still open and still functioning?
Well, they're doing a variety of things. We speak often with Dr. Bell, and we use the advice that is given by the CDC, which is very detailed: the wash hands, social distancing, the cleaning, but we're following those guidelines, and schools are doing that all the time and are doing a very good job of it, I think.
So in terms of the cancellation of schools for these other districts across the state, was it just like a multitude of cases in the state in order to correlate to a cancellation, or how would that procedure work?
Right, and I think we rely again on DHEC. They're looking at the facts of what's happening in those districts. There's no reason at this time for any other district in the state to close. We'll be talking with them, and of course we watch this by the hour, so things could change. But we need to continue to put the health and safety of our students and communities, but at the same time we want to balance that. Children need to be at school, and we need some normalcy in their life. So we're doing everything possible to keep that normalcy and to keep our schools open, basing our decisions on closure on the facts, not letting emotion take over. So I really, as the governor said, I appreciate the work that the school district personnel, the teachers, principals, superintendents are doing in trying to stay calm and base their decisions on the information that's given us by DHEC.
Dr. Bell, is there any reason to believe the newer cases in Lancaster County are connected to the cluster across the line in Kershaw?
We're continuing to conduct a contact investigation around the new cases that have been identified, and if we identify additional information that others may be at risk, and we will make those notifications.
In a household of several members where one is infected and may have young children to care for and they have to be self-quarantined, any guidelines for maybe a parent who has to take care of a child but they are positive for norovirus? Any guidelines for that?
There are guidelines from the CDC about home isolation precautions to take. If an individual doesn't require hospital care, they can remain in their home, recommended to be in a room away from the rest of their family members, and there are instructions for what family members can do to help provide care, to provide food, and to provide assistance. So that information is on the CDC website.
Now, President Trump just announced working closely with the private sector to get more widespread testing availability. What does that timeline look like here in South Carolina? When might we see the private sector roll out some of this testing capability, and how many tests might be available then per day rather than just 100?
Well, we have, DHEC has over 1,000 tests available now. We've plenty, we have ample supplies, but what the president has done with those big companies is a great step forward to have the public sector involved in making those provisions available. As of right now, we have plenty in South Carolina.
Governor, speaking of the president, have you talked with him lately about what we're doing here in South Carolina?
Not lately. The latest conversation we had a few days ago with the Vice President and the Secretary of Health and Human Services, as well as a variety of others.
Governor, what's your message to these parents in these affected counties that have students now home from school and they're juggling work, they don't know what to do? What's the message? Is it relief for these people that are trying to figure out child care and also trying to make sure they can get food on the table?
My message is that we are in a great state with great people, and this is we will get through this. We have the professionals, the highest professionals you can find in the country, who are giving us information, advice, and guidance. We have the support of the federal government, a very vigorous support, and we'll get through it. But this is certainly a tough situation. There will be dislocations. There will be more, but we will get through it.
Are you working with the business community to maybe help alleviate some of these?
Say it again.
Are you working with the business community to help alleviate some of these?
Yes,
pressures?
we're staying in constant contact with the business leaders and providing all the information so everyone knows what's happening, what we believe might happen, and is in the business community, having more certainty and more understanding is always important. Parents need to know what we know, and that's why we're having conferences like this one. We know that the more information is out there, the more people can make their own decisions based on their own particular situation. But we know this is a crisis, but we also know that we have the capability and the people, the professional leadership to get through it.
Superintendent, what would be the deciding factor to close all school buildings?
That would take some significant increase, and I believe the advice, I rely totally on the advice of our experts, and we're not there yet. It may come. If it does, we'll work with those individual communities appropriately.
And just to clarify, could a school district decide to do so even without consulting or maybe against the recommendation?
Well, the governor has asked us to continue in consultation with them, and I hope that that's what they'll continue to do.
Are there any more questions?
Dr. Bell, one last question for you. I know, we've heard the basic, wash your hands, cover your cough. You hear state of emergency and people, there's a lot of fear concern. Is there anything else they can do? Any other precautions they can take on top of that?
We keep repeating those because those are the effective measures. And we want people to understand that washing their hands and removing germs from your hands prevents the introduction of the virus in the body. If you're sick, staying home prevents the spread of disease in the community. So the same message that we have been saying all along are really the same messages. The increase in transmission across the United States is expected if people don't follow those measures and take them seriously.
Dr. Bell, I know there's been a lot of people going to stores across the area buying like toilet paper, hand sanitizer, cleaning supplies? Do you think there's like any urgent supplies they need in order to combat this that they could really rush and buy this for it?
Not necessarily, because there's soap and water. We know that that there's a big demand for hand sanitizer, and that's recommended if soap and water is not available. But stocking up on other items only depletes the supply and makes the situation seem more alarming than it really is.
What is the capacity in our hospitals in terms of being able to isolate people and treat them? Do we have a certain number for how many cases we can handle in the hospital?
The bed capacity is monitored, and the Hospital Association can help with that information as well as other information from DHEC. So bed capacity is available.
Thank you very much.